Thanks everyone for joining. Can everybody hear me? Okay, so first of all, thanks everyone for joining. My name is Tyler Hansen. I've been at MedPro for 7 years, and I've been in sales. I've been moved up to the sales manager here, running a team working with Henry Schein reps and customers. So wanted to kind of go through this webinar, kind of explain the efficiency of your waste streams and keeping everything for your facilities as best as possible, as far as keeping your costs down and going through what waste streams are going to pass through a healthcare facility. So I'm going to go through this deck here. I'm going to share my screen. And so we will, you can have questions in the chat. You can put them in at any time. We'll get to them at the end, and then any questions that come up through we'll answer at the end of this webinar. So going first, I just introduced myself. I've been here for 7 years, and I'm about to go through this PowerPoint here. The overview here, we'll be talking trash today. So from your traditional waste streams to regulated medical waste, we're going to review how your business become more efficient and save with a few simple tips. What's in it for you? You know, we found about 80% of the healthcare practices are overpaying when it comes to their medical waste and are unaware of alternative options that provide similar service up to thousands in savings each year. And we know this based on, you know, 98% of our customers come from one large national provider that owns 80% of the market. So after doing market research and working in the healthcare industry as a company for the last 12 years, we've come across many customers that have been overpaying. So we're going to go through that right now. Some of the common waste streams you're going to find in healthcare. You're going to have sharps, any biohazardous material that can puncture skin and is contaminated with bodily fluids. You know, those will go into the sharps containers. Any medical biohazard waste, known as RMW, which is any infectious contaminated waste that is, you know, gloves, bloody gauze, any type of saturated waste that would go into the biohazard waste box. You'll come across that, and then you'll have trace chemotherapy, any materials used to prepare and or administer chemotherapy medications. They are handled and disposed of differently. They actually are incinerated, and we'll get into the methods of treatment here down through the presentation. Some other additional common waste streams in healthcare is pharmaceutical, any unused expired medications and over-the-counter personal care products. Different types of medications require different disposal processes. They're usually incinerated. You'll come across non-controlled, non-hazardous, and then you'll also come across, you know, if you have some controlled expired meds that are scheduled 2 through 5, those will also need to be separated from your red bag medical waste and sharps. So how to create efficiency. This is to keep your costs down. And there are 3 key components to pay close attention to. Yes.
I'm just chiming in. We're on slide 3. I don't see slides. We're on slide 3. I think you've progressed past the housekeeping slide.
Okay, so is it not showing up? Because I'm going through on my end. Let me see here.
There we go.
We good?
Yep.
Okay.
Slide 5.
Okay, so I just went through. I can go back. Common waste streams are your sharps. biohazard material, medical waste with garments, bloody gauze, those items, trace chemotherapy. Those are all common waste streams you're going to find in the healthcare. So what I was going to get into is how to create efficiency to keep your costs down. This is the biggest key component for healthcare providers, and that is waste classification. So what is considered actual biohazard waste, and then what is actual considered, solid waste that'll go in your regular trash. Your service frequency, so how often your facility is being serviced, can have a dramatic impact on cost to your facility. And then obviously consistently reviewing your usage is important to containing and controlling your costs. Basically everything is built off of volume and frequency in this industry. So, the more often you're getting picked up and the more waste you're getting picked up, obviously the cost is going to be higher. So there's some ways that you can keep that cost down if you're able to, and we're going to get into that into the next slide. So medical waste can be expensive. By weight, medical waste costs about 8 times more to dispose of than your traditional waste, and 85% of medical waste is deemed non-biohazardous. So additionally, it's important to properly identify waste that needs special service, including tissue and more hazardous materials. You want to eliminate overuse. Materials that are used in medication preparation, such as syringes or chucks, things without needles that do not need to be put into a sharps container or pose any risk to patients and staff, can be disposed to in your normal waste stream. So key takeaways from this slide would be, to train your staff properly, know what needs to go into the biohazard and what can go into the trash. Here at MedPro, we actually provide posters to put above, the biohazard area boxes, where it lets you know what needs to go into there and what doesn't. But to properly train your staff so you're not putting things in there and filling the box up with items that do not necessarily need to be in there and can go into the regular trash. By clearly displaying guidelines for what does and does not need to be disposed of in your regulated containers, you can guide your staff towards better decisions, and we provide that here at MedPro. Service frequency. So your service costs are basically impacted where your office is. So where you're at geographically, whether it's a remote area in, say, Montana, or you're in a metropolitan area, everything's built off of route density. So how many stops the driver makes in your area can create some efficiencies there. So it's easier to add a stop than to create a whole new route for the driver. So if you have opening facilities in a given area, that actually helps with added stops to a route rather than building a route altogether in itself. So cutting down how often you're being picked up is worth taking a look at if you have the space at your facility to store an additional box or two. So for example, if you're getting one box picked up every week, your costs could be dramatically decreased if you went to, say, 2 boxes every other week, or maybe 4 boxes a month if you have the capacity to store that. Some facilities will have a shed outside where they store their waste so that they can have less often pickups, but more waste picked up on a given time, because the more waste picked up on a less often route is actually more beneficial and cost effective for the biohazard waste removal company, and they pass the savings along to the customer. So there's a way to do that. Definitely take a look at that. By consolidating multiple smaller pickups into one larger service date, you'll spend significantly less. Also work with a national company, take advantage of economies of scale, and work with a larger company servicing multiple businesses in your area already. MedPro covers the entire continental US. So we do have routes all across the country, whereas maybe a local hauler only covers a certain region, and then you're kind of left going. If you grow as a business and go to another state, you may have to have multiple vendors if you're not with a national vendor. And then service volume. So how much is enough? Keeping an eye on how much you typically generate and planning ahead for busier times is one way to make sure you don't get any surprises on your bill. I know here at MedPro, the way we operate is, you're allotted a certain amount per month, and then if you go over that amount, there's an additional container cost. So by keeping an eye on your usage and knowing, hey, our waste stream has dramatically gone down or it's gone up, and letting the vendor know right away, you can actually, the more boxes you have, the better per box cost you could get. Or if you're dramatically decreasing your waste stream, you don't want to be on that same scheduled frequency because you're going to be paying for a service that you don't need as often. So some key takeaways here. You're going to want to make sure that, nobody likes additional fees, obviously. So make sure your vendor can tell you what your costs will be for the length of your contract, what any overages will cost. Make sure it's clear when you're signing an agreement. If you're signing up for an allotted amount, what's the additional container charge? Should be crystal clear, and MedPro provides that as well. Healthcare is constantly changing. Business and working with a hauler who can adjust your services needs, and they change as they change is a crucial to ensure you don't pay more than you need. And so, one thing you want to do is if you're able to be with a company that's flexible and not give you like, okay, sorry, we can't come, less often than monthly, you have to pay for that. You want to work with a company that can come to your needs and fulfill what your service needs are as far as a waste stream and what you're getting picked up, and able to bounce back and forth. If it picks up during flu season, or if it drops in the summer for whatever reason, you're going to want to make sure that you're with a vendor that is very flexible and can accommodate any changes in your healthcare facility. So a big question that a lot of healthcare providers want to know is, where does all this waste go? It's one of the most common questions we hear. Basically, in the medical waste removal industry, the autoclave process is about 85 to 90% of how waste is treated in this industry. It's the most environmental friendly as well. And it, regulated medical waste, sharps, all get autoclaved. The only type of waste that gets incinerated, which is, burned at a highly controlled environment until it's reduced to ash. This is commonly for like animal carcasses, fat, tissue. Plastic surgery offices have this type of waste a lot. So that's the other 10%. That cost is a little bit higher. So you gotta want to keep an eye on what kind of waste you're getting rid of, as far as if it's pathological or if it's just regulated medical waste. The autoclave process is a process where the waste goes through a high pressure steam and then shredded and then put into a dedicated landfill. So once it's deemed that there's no pathological contaminants inside the waste, then it is put into a regular landfill. Chemical treatment, this doesn't happen often. It's not used very often. It's usually only used during hazardous types of waste, such as chemicals or any type of RCRA hazardous waste. That would be in that part. So let me see here. Let's go to the next slide. About MedPro Disposal. So, here we're driven by experience as a medical waste disposal for the customer. So we not only provide medical waste disposal services, we were once also a customer too. We've used the experience to build our business by providing the service we've always wanted as a customer. So including flat rate pricing, friendly customer advocates. So we have a whole dedicated account manager team. We have clear contracting terms with no surprises. If your service provider isn't treating you like they should, it's time to make the switch to better service with affordable rates. Our CEO was actually a customer of one of the national providers, and they were being overcharged, and he was looking into it in the industry, and he found that there was a very good opportunity to help healthcare facilities save as much money as possible. And that's where he started his own business about 12 years ago, and here we are today with flat rate pricing. You're only paying what we quote. So any quote that we give you, that's what's going to be on your invoice. We have flexible bundling options. So we have other services that we that we offer, such as OSHA compliance training, pharmaceutical disposal, document shredding as well. So utilizing all these as a one-stop shop will keep your costs down as well using one provider. Dedicated customer advocates, as I mentioned previously, we have a whole dedicated customer service team to each account. So any questions, any requests, they are all, they all handle those requests. We actually have a nice manifest portal that you can log into, pay your bills, retrieve manifests, and then also, request anything from customer service. And then obviously practice protection. We have a compliance solution for facilities that covers OSHA and bloodborne pathogen training, HIPAA trainings, DOT, everything that a healthcare facility would need in order to stay compliant in this industry. And then not to mention, we also, we have $11 million insurance policy, and we transfer title to the waste, and that's important. Transferring title. And then in medical waste removal industry, the customer, the generator of the waste, holds title from cradle to grave. So when you create the waste and it gets transported to the treatment facility and put into the ground, you hold title unless the company you go with actually transfers that title. And there's only one or two of those in the entire country that does that. We are one of them, so we take all the risk off of the customer. Once the waste is on our truck, we assume all liability in case there was an accident or any type of waste fell off the truck or anything like that. It would never come back to you, the customer. So we pride ourselves on taking risks off the customer, and we spend a lot of money to do that. But that's pretty much it for the slideshow. If there's any questions as far as anything we've covered here today, you can email us directly at sales@medprodisposal.com with any questions. You can also call if you want to quote. The 866-254-2961 is our direct line for the sales line if you want to give us a call and request a quote. You can also reach out to me personally. My email address is Tyler, Tyler, @medprodisposal.com. So yeah, if there's any questions, we can go through those now. I don't know if I see any questions on here, Justin, or.
Yeah, Tyler, so thank you for taking the time to present. And everybody on here will be getting a follow-up email with this contact information and some further information on the MedPro solution, as well as the contact info. We do have a question regarding what does the process look like to change from their current provider over to MedPro? So what does onboarding look like? How much time does it take? Can you kind of just walk through with that transition, how that transition plays out?
Yeah, it's a great question. So, you're obviously, it's a contractual industry. So depending on where you're at in your contract, there's a couple different ways. Basically what you would do is you'd send a cancellation letter to your current vendor, on company letterhead stating, your account number, and saying you wish to cancel services effective immediately, or maybe you have a date in mind, maybe you want one last pickup. And then you would sign with MedPro, put a start date for 30 to 60 days out, just so we can get you into the system, because a couple of things happen on the transition. Basically, two things will happen. They'll either come out and take everything right away once they receive the cancellation notice. I've seen that many times. So we want to have you set up in the system so that we can get out there, get you supplies. If they take everything, make sure you're OSHA compliant. If they come by and they don't see any biohazard boxes, you could get dinged on that. So want to make sure that you're set up before you send the cancellation letter. And then the second thing is there could possibly be a termination fee involved. I know with the largest national company, there is usually a 50% of the remaining termination fee. So let's say you have a year left and you want to cancel, you would be due to owe 6 months of the monthly invoices to them in order to get out of the contract. Now, there's certain situations where we can actually structure a financial agreement to offset that termination fee, so that we basically pay it indirectly. We're not going to send you a check to send to them, but by financially structuring an agreement so that it offsets that termination cost. We've been able to do that many times as well. So it really just depends on the situation where you're at in your current contract. But the transition is pretty much seamless, and if you know your contract end dates and say, let's say it's September 1st, basically we just do a supply drop on that week of the last pickup with your current vendor, and that way it's a smooth transition so that the boxes are there. When they take their boxes, you have our boxes, and then we're ready to go going forward.
Fantastic. I think that was it. So like I said, everybody who joined will receive a follow-up email, points of contact, and some information within the next 24 hours. And thank you, Tyler, for spending the time.
Yeah, no, appreciate it. Thanks for having me. And if anybody has any questions or anybody needs anything, my number is 847-794-1013, and my email is Tyler, Tyler, at medprodisposal.com. You can also reach out to the medprodisposal.com website, and then the number to call is 866-254-2961 to request a quote as well from my sales team.
Great, thank you.
All right, thank you.